Hi everybody and welcome to this Healthy Minds video, which is all about anxiety. Now this is going to be in a few different parts, so this is part 1. Today we're going to be talking about a few different interventions for mental health problems, and we'll be talking about the symptoms of and treatment for anxiety disorders and depression. Again, we won't be covering it all in one video, and this is just part 1 of anxiety. So what is a mental disorder? So these are conditions that are characterized by behaviors, thoughts, and emotions that really impair your daily life. So that sometimes can be unusual behavior, but most people who have a disorder don't exhibit any kind of peculiar behavior. Now, it's particular clusters of behaviors, thoughts, and emotions that are required in order to make a diagnosis. To help professionals do this, so it has to be a mental health professional with training and experience, to help them do this, we have things called classifications. So there are 2 main ones that we use in Australia. The first one is an international classification of diseases, and the second one is the Diagnostic and Statistical Manual of Mental Disorders. So we call this the DSM, and it's had several different iterations and changes, the latest being the DSM-5. So in your textbook, you'll find information about the 4 and the revised 4 version, but the one that we use now is the 5. So, important thing to note here that links again back to what we were talking about in terms of mental health disorders and culture is that these DSMs are constantly being changed and refined and revised. So an example of this is homosexuality. So in 1968, this was listed as a disorder, and it was then removed in the early 70s. Now, it also applies to Western cultures only, as it doesn't contain disorders from other cultures such as Koro. So this is a handy little graph from our textbook that talks about the prevalence of mental health disorders by sex and by their category. So we look here at affective disorders, which includes things like depression, and also our anxiety disorders. So these are the main 2 that we will be talking about, and just some interesting notes here in terms of males versus females. So again, these are the 2 that we are going to be focusing on. Now remember here, as you learn about anxiety and then again depression, remember those comments from our first video. A little knowledge can be a dangerous thing. Make sure that you're not trying to diagnose other people. Also make sure that you're not trying to diagnose yourself. Again, if this brings up any issues, of course, really important to go speak to a mental health professional or a GP or any of the resources that we have on our website. So, what is anxiety? Now, we know from our work in arousal and looking at stress that we can have a fight or flight reaction to danger. And that's very normal. So it's normal to have an anxiety reaction, whether it's fear, anxiety, or worry. However, when it becomes a disorder is when it really heavily impacts your daily life. Now, anxiety disorders are one of the most common disorders in the general population, particularly in Australia, and approximately 10% of the population will experience anxiety disorder at some point in their lives. So women in Australia are unfortunately 2 times more likely. And again, this anxiety occurs very frequently. So that feeling of anxiety occurs very frequently from those who are diagnosed. It causes them significant distress and impairs their daily functioning, whether it's work or school or whether it's your social life. So these are the main types of anxiety that are outlined in the DSM-5. Again, they're slightly different to those outlined in the DSM-4, so important to stay up to date. The main ones that we will be looking at are specific phobias, social anxiety disorder, panic disorder, and generalized anxiety disorder. If we have time in class, we will then look at schizophrenia, but that will come up a little bit more when we talk about the integration of the 4 levels of explanation. Now, when we talk about general treatments, each of the disorders that we'll talk about have slightly different approaches. However, generally speaking, people are treated in one of 3 ways or a combination of 3 ways. The first one is systematic desensitization, which you will remember from our learning topic. So if you need a recap of that one, please go back to our learning video. The next one should look very familiar to you by now. It is cognitive behavior therapy. So looking at unhelpful thoughts, unhelpful behaviors, and really trying to tackle them both holistically to improve people's lives, I guess, more generally. Now, the last one is medication. So you can be prescribed medications such as benzodiazepines. They help people relax. But again, these are a short-term thing. So most of the time, there will be a combination of medication and CBT as well. So that's it for this video. I just wanted to really briefly introduce disorders and anxiety. In the next video, we'll look more specifically at some of the anxiety disorders in terms of diagnosing them and treating them. See you next time.